Thank you, Paul. Coming up next, heart disease impacts a lot of people. You may know someone who's been affected. The new medications and procedures designed to save money and lives.
Well, 610,000 deaths every year and thousands of dollars in healthcare costs. That's the grim reality of heart disease. New tonight, we find out how new medications, procedures, and some simple steps can save you money and maybe your life. Here's Lindsay Heuser.
When Dandita Coleman noticed a pain in her leg, she wasn't really thinking about her heart. But her diagnosis of peripheral artery disease was also a warning about heart health.
Leg pain, maybe at night, cramping at night, or pain when you walk may be the first sign that you have blocked arteries.
Dr. Richard Heuser with the Phoenix Heart Center at St. Luke's Medical Center says it's important to recognize symptoms that could lead to heart trouble early because the cost to our health and the healthcare system are enormous.
Just the cost for high blood pressure worldwide is in the range of about $100 billion a year.
But he says new advances are helping bring that under control. He's pioneered a technique to clear arteries that cuts out a hospital stay.
Even in patients that have had 100% blocked arteries, we have the patient go home usually about 2 or 3 hours after the procedure.
Statins are helping fight cholesterol, and the FDA just approved 2 new drugs that could help even more, although right now they're very expensive. Heuser says fortunately research shows there are easier ways to save your heart and your money.
If you lose just 5% of your body weight, markers in your body of inflammation or risk for stroke, risk of heart attack can literally be reversed. For instance, if you lower the high number on your blood pressure by as little as 2 millimeters, you'll reduce your likelihood of a stroke by 10%, reduce your likelihood of a heart attack by 7%.
In most cases, Dr. Heuser says you could meet that goal just by not adding additional salt to your food at the table. Coleman is still on medication after having the blockage in her leg surgically treated, but hopes added exercise and changes in diet can help.
Diet is very, very important. And doing that, eventually, maybe I can come off of the cholesterol medicine.
Well, that was Lindsay Heuser reporting for us tonight. And Dr. Heuser says, while those might seem like obvious suggestions, the fact is many people still ignore them. But he says the impact on your heart health can be life-saving.